joining us. I hope everyone is doing well. I'm Jennifer Lopez, the CEO of the BMCC. Welcome to the BMCC CEO Insight Series with Dr. Jonathan Pan, the Vice President and General Manager, Malaysia of GlaxoSmithKline Pharmaceutical. It's an honor, Jonathan, to have you with us today, and we look forward to your leadership insights on the theme, Making Health a Priority. Ladies and gentlemen, as we emerge from the COVID pandemic, healthcare has transformed through great partnerships, collaborations between healthcare providers. We have seen strategic and effective public-private partnerships to meet the demands of the healthcare sector during the pandemic. Realigning health priorities at policy level to enhance the healthcare system has also become instrumental in improving health of a nation like Malaysia at organization level, as well as for us as individuals. We will begin our session today with a presentation by our esteemed speaker, followed by a Q&A session. So please do be forthcoming with your questions to our speaker. This is your opportunity to ask questions to a subject matter expert from a healthcare industry. So please submit your questions. Do so via the Q&A tab that you will see on your screens. So before we begin, let me give you a short brief about our speaker today. Jonathan Pan, as I mentioned, is the VP and GM of GSK Malaysia. Prior to his role in Malaysia, he was the VP of Medicine Commercialization Leader, Hematology, and a member of the Global Oncology Therapy Area Leadership Team. In his role, John successfully led a cross-functional team to various milestones in preparing for GSK's first oncology medicine approval since 2013 with the launch of BLENREP. I may not be pronouncing correct, John. Maybe you can correct me later. Okay. Prior to GSK, Jonathan has also held various senior commercial, marketing, and BD roles at IV Genomics Medicine, BMS, and J&J. So Jonathan, without further ado, I'll pass the session to you.
Thank you very much, Jennifer, for the warm welcome and the opportunity to speak. I also want to thank Karen and Ira and the rest of the BMCC for this great opportunity. And I also want to just say a very special thank you to Amir Emran and David Lin from my team for supporting me through this particular talk. It is absolutely a pleasure to be discussing this topic. It's a topic that is near and dear to my heart, and something that I am incredibly passionate about. And today, as we discuss about making health a priority and the things to think about as we make it a priority at the country level, company level, and quite honestly, a few reflections from my own personal self. With that, maybe if we could share the slides, maybe we can start with that. If we go to the next slide. Just a little bit of an introduction about GSK. I'm sure many of you know GSK from your times in the pharmacy, etc. But a little bit about GSK in terms of looking at our purpose. We are a science-led global healthcare company with a special purpose to improve the quality of human life and to get ahead of disease together by uniting technology, talent, and innovation together to really drive positive impact for patients. So as we think about this as an organization, if we go to the next slide. Health is a fundamental human right, the highest attainable standard of health as a fundamental right of a human being. And hopefully, as we start to go through the next couple of slides, a question for you to reflect on is, how well do you know the Malaysian healthcare system? And how can Malaysia make healthcare a priority? And I think these are, in this particular section, it's a real good opportunity for us to think about and reflect around what is the purpose of healthcare? And ultimately, how do we ensure that healthcare works for us, especially as we as a country begin to emerge and continue to grow over the next 5 years, 10 years, 20 years, and so forth. If we go to the next slide. If you look at the healthcare system within Malaysia, I'm sure many of you know there is a public system and a private system. But the history of the healthcare service in this country actually dates back well before independence to 1808, with the founding of Hospital Taiping, which is one of the oldest hospitals ever built within Malaysia. Primary healthcare is the thrust of the Malaysian healthcare system, and it's supported by secondary and tertiary care centers with almost universal healthcare access. And in 2019, there were around 47,000 beds available in public hospitals in Malaysia, and in comparison, about 17,000 hospital beds in private hospitals. You can appreciate that the healthcare system within Malaysia is quite large and actually has quite a long history as it continues to operate. So if you go to the next slide, I think as many of us have learned over the last couple of years, the healthcare system has really shown incredible resilience. And why I say that, I think it goes without saying that the last 2 years, being within the COVID-19 pandemic, has proven that not only is healthcare critical, it is essential for the fundamental operations, livelihood, and general commerce, and enabling general commerce within the country. And the need to better manage potential future outbreaks, healthcare crises, and other events is absolutely necessary for us to work to continue to build. As we emerge from the pandemic and we move from a pandemic to an endemic stage, we've learned many lessons and how we can take those learnings and leverage those learnings to really revitalize our healthcare services. For example, the Ministry of Health during the pandemic outsourced some of its activities to private hospitals and other hospitals under other ministries in order to optimize the healthcare capacity of the country. An effort to synergize and fundamentally democratize healthcare for all people in Malaysia. Not only were you able to go to a private hospital, you could also go to a public hospital, and the ability to walk between the two and achieve similar outcomes, healthcare benefits and outcomes, was realized. The pandemic then led to increasing public-private partnerships that reflect the evolving nature of healthcare, whether it be from vaccinations, whether it be from care coordination, whether it be for, as I mentioned, the private and public hospital dynamic that existed as a necessity to manage the pandemic. So now, where do we fit in the picture? Where does a company like GSK fit in the picture? And I think in improving the healthcare outcome of many Malaysians, the access of safe, effective, and innovative medicines is vital, especially as new diseases emerge or become more prevalent. I am incredibly proud of my colleagues at our other companies that are servicing and really working to provide innovative medicines to really overcome the challenges of the COVID pandemic. But beyond the pandemic itself, many other diseases as well, and I'm incredibly proud to work with them to really help and support an infrastructure to provide better health. Now, we don't run into a pandemic all the time, and while these are great lessons, if we go to the next slide, if the pandemic didn't happen, if the pandemic didn't happen, and we think about the 11th Malaysia Plan back in 2015, 2016 timeframe, if we use those benchmarks about the healthcare system in the 11th Malaysia Plan, and we compare the actual performance of the healthcare system in Malaysia during 2016 through 2020, we actually see the performance of the healthcare system and service delivery were well below target. reflected by low performance of the healthcare component in the Malaysia Wellbeing Index, partly driven by the fact that we were seeing increases in infant mortality, maternal mortality, and a rising incidence of non-communicable diseases. Targets for doctor to population ratios and hospital bed to population ratios remain unmet. So I think it goes without saying that while the intent of having a good healthcare system is definitely on everyone's radar, the fundamental fact from 2016 through 2020 showed that the ability to scale, to really build the necessary improvements as laid out in the 11th Malaysia Plan were unmet. And if we think about the new 12th Malaysia Plan, some of these critical priorities are continuing to be reviewed. And it's a really great opportunity for many of the ministries who are working on this to continue to prioritize healthcare for Malaysians as a critical success factor for many of the ambitions that the government has for Malaysia as a country going forward into the future. And if we look at the 12th Malaysia Plan, enhancing that healthcare service is a critical priority area. And three key components of healthcare service delivery to bear in mind are the following. Doctor to population ratio of having a target of 1 doctor for every 400 people, having two beds for every 1,000 population, and improving emergency response times. I think that's a really, really critical thing. Many diseases and occurrences of healthcare can be treated and resolved if responded to in an appropriate amount of time. And with the investment of new information technology, other technology advances, such as electronic medical records and telehealth that many companies within Malaysia are bringing, we have the ability of not only creating efficiency, but we also have the ability to create scale. And potentially with the implementation of many of these technologies, we will be able to service, according to a recent study from McKinsey, a global consulting firm, that potentially you would only need 1 doctor for every 1,800 people in Malaysia, allowing great leverage within the healthcare system. And this shift to digital healthcare will only continue to create leverage and continue to build scale within the overall system. If we go to the next slide. So why are we doing this? Why does it matter? And why do we care, quite honestly? And fundamentally, I think for Malaysia in general is a young country, not only from a perspective of recency from the time of independence, but fundamentally from an age perspective in Malaysia. Malaysia has a relatively young population where it is more skewed toward below 65. Now, as Malaysia continues to advance and grow, we're going to see challenges within society by 2030, where we're expected to see that by about 2030, we're going to see about 15% of the total population being 60 years and above by 2030. And what we see now is probably much less than that, around 6 or 7% that are 60 years and older. So as you think about as the population begins to age, this is actually when we start to see more burden of disease. And the impact it has on healthcare. And so we have a great opportunity from now over the next 10 years and supported by the 12th Malaysia Plan to really think about how do we continue to build infrastructure and healthcare to support a growing and aging population. Just as an anecdote, if you look at 15% of the total population will be 60 years and older, that's about the same distribution that the United Kingdom has in 2020. And we all understand how the healthcare system within the United Kingdom operates as well. And we have the opportunity to potentially learn from that experience and to improve upon that experience. So if we go to the next slide, and this will be my last slide related to thinking about it as in totality as a nation. Again, if we focus on the 12th Malaysia Plan, measures will focus on strengthening healthcare policy, combating not only communicable diseases and non-communicable diseases, but also thinking about enhancing healthcare programs for older Malaysians within the plan. So if we look at the Ministry of Health priorities, and you have to give your hat, tip your hat to the Ministry of Health for managing not only a global pandemic, but also really setting the priorities on how do we build a healthier Malaysia and how do we continue to maintain the momentum of progress that we see within many, not only in healthcare, but in many of the sectors that we see within Malaysia that require healthy, capable, and quite honestly, happy people to continue to really build critical infrastructure that will take Malaysia to greater heights. In the priorities for Ministry of Health, if I look on the communicable diseases perspective, it's really about prevention. As the saying goes, an ounce of prevention is worth a pound of cure. And if we think about healthcare expense, management, etc., prevention remains the key. And healthcare burden can be reduced with potential access to simple things as vaccinations. We see this in the COVID-19 era where almost 80% of the population is vaccinated. We're seeing almost 98% of adults 18 and over in Malaysia are vaccinated and greater than 65% boosted. The ability to vaccinate children 5 to 12 began in early February, and we're seeing positive impact there as well. So again, incredibly reassuring information from the ministries to really focus on preventing disease. And as you start to see the management of COVID now in April of 2022, we're starting to see a big turnaround, and it just goes to show that prevention is key. But outside of COVID, there are other diseases that are also benefit from prevention. If I look at pneumococcal vaccinations, pneumococcal vaccinations creates invasive pneumococcal disease in children, and the ministry in early part of 2020 had initiated the inclusion of pneumococcal vaccinations into the national immunization program, which really is a critical area to invest in to ensure that we manage not only COVID as an example, but also other invasive diseases. Human papillomavirus, which has been linked to cervical cancer and other types of cancers, was implemented in 2010 as part of public healthcare facilities for immunization. Diphtheria, tetanus, pertussis, and hepatitis B and polio vaccinations continue to be incredibly important. In fact, in December of 2019, polio was detected in Malaysia for the first time in 27 years. And it just goes to show you that routine vaccinations and vigilant vaccinations has the opportunity for us to continue to manage that. And then lastly, from a communicable diseases perspective, is around HIV, human immunodeficiency virus, and to really think about the progress that the ministries have had to really break that cycle of transmission. In fact, in 2018, WHO recognized Malaysia as the first country in the Western Pacific region to eliminate mother-to-child transmission of HIV, which is incredibly important to break the cycle of transmission. So that's related to communicable diseases. If we look at non-communicable diseases, things like cardiovascular disease, hypertension, diabetes, cancer, mental illness, injury-related conditions, etc. They contribute about 73% of total deaths in 2018. And again, the ability that the Malaysian government, the Ministry of Health, and others have really prioritized not only communicable diseases, but also non-communicable diseases. The scheme Peduli Kesehatan untuk Kumpulan B40 was launched to address the healthcare needs of the B40 population as well, which remains, quite honestly, one of the most vulnerable populations within the Malaysia society. Many efforts have been intensified to combat non-communicable diseases, particularly in heart disease, diabetes, cancer, and mental illness. And we'll talk a little bit about mental health issues a little bit later. but it is incredibly important that we continue to focus on these diseases and the emergence of new ones like mental health that then needs more prevention, measures for prevention, intervention, and treatment. Now, I'm not going to talk about how we're going to solve that. I think for many people on the call and today in the discussion, the solution is not always 100% black or white, left or right. It's really thinking about the holistic direction that we as constituents within the country need to think about, and how we want to prioritize and how we want to resolve some of these areas. But I think that hopefully opens up the conversation and opens up the debate a little bit. So if we go to the next slide, I wanted to just give a little bit of taste and flavor from us as a company. As you can appreciate, we have quite a number of individuals within GlaxoSmithKline, within Malaysia. And you know, although we are a healthcare company, the question ends up being is how do we make health a priority for us as well? And again, just to give you some perspective, if we go to the next slide. Not only our passion and our drive and our motivation is to provide differentiated, high quality healthcare products to as many people as we can. That's what we do. But quite honestly, we have to think about why we do it. And if you go to the next slide, we fundamentally want to improve human health. And I know that it's really easy to say, and sometimes we have to, no pun intended, have to take our own medicine as well. And I'll share with you some of the things that we do to maintain the health of our employees as well. If we go to the next slide. If you think about some of the key medicines and products that we provide, here's a general overview of some of the products that we provide, from allergy, anti-infectives, respiratory, vaccines, HIV specialty, oncology, and other types of things. But I think the ability for us to provide these medicines is key. And as you can appreciate, within a context of the last 2 years during COVID, and the ability for us to maintain the passion and the motivation has been trying and daunting. There is no doubt related to that. And I wanted to share on the next slide, if we can go to the next slide, I wanted to share with you some of the things that we do as an employer and as a company to really make sure that we maintain health as a priority as a company as well. And fundamentally, people power our business. The products are important, but the people power our business. And as a modern employer, we believe that when we feel at our best, we perform at our best. And the ability for us to be you, you know, we all bring something unique to GSK, and when we combine our knowledge and experiences and styles together, the impact is incredible. And I can of all the hundreds of colleagues who call GSK their company within Malaysia, you know, everyone brings a unique perspective, and we allow that perspective to continue to fuel our innovation, as well as fuel the ability for us to continue to do what we do to enable access for patients. The other one is around feeling good. When we focus on our well-being and have the flexibility to manage our lives, we can thrive and do great things at work and home. One of the key initiatives that we really brought forward during the pandemic, which I thought was incredibly important, was called something we call performance with choice. And from that perspective, even though we have an office, and even though we, can come in and work within the office, I think we basically have figured out that we can do our work anywhere, as long as we continue to do what we need to do to enable that patients are supported, our doctors are supported, and our healthcare stakeholders are supported. And so I think from our perspective, we don't mind where you work, whether it be at home, whether it be taking your kids to school, or picking up a loved one, as long as you're able to do what you need to do to feel good, both to balance between work and home. The last one is around growing. Our world is always changing, so we must take every opportunity to learn and develop. And when we grow as individuals, we grow as a business, and we take a really great pride in making sure that we give people the opportunity to continue to learn and develop and to really drive their own development and to really build the capabilities that they want to build to do that. I think coupled all of these things, people feel good and people feel empowered to really to be at their best, and because they feel their best. To give you some more tangible examples, we have a very robust employee health and wellness and well-being activity. If we go to the next slide, if we go one more. From an employee health and well-being and employee assistance program type of areas, and I promise this is not I'm not selling the HR benefits, but I think it's really important to really think about it. And I think for most companies, we underestimate the value of these programs, whether it be monthly health bulletins about giving good information, high quality information about vaccinations, seasonal allergies, weight management, these type of things. These are all critical things to help our employees and our colleagues to better manage their health. We talk about ergonomics. We sit at our desks, whether it be at home or in the office, and for some of our colleagues working in their cars, we want to make sure that we have the conversation around ergonomics and making sure that our body postures and how we stand and feel is important, because it does affect our mood and it affects our well-being. We talk about our well-being. How are you feeling? It's a very simple question, but it's a very powerful question. We also provide a lot of activities to think about lifestyle changes, smoking cessation, eating well, and how do we stay fit? How do we get the latest information about COVID-19 as an example? And I think it's really important. Our HR head, Kunal Kumar, does a very great session where he leads our colleagues through what we call through as mindfulness, right? A lot of times our health is really impacted by how we feel, and really to have that conversation and really to practice that mindfulness to really calm our minds down can absolutely help us feel better. And I think the feedback from our colleagues is that that's been incredibly useful to help, especially during trying times during the pandemic, where we have so much uncertainty, a lot of competing priorities, both from work and from home, as well as other areas as well. So I think these are some of the things that we as a company prioritize to make sure that our colleagues remain in good health, and we make that a priority. So if we go to the next slide, I'll give you some personal reflections about from my perspective. How do I make healthcare a priority? How do I prioritize health? As you can appreciate, there is no dull day in my job. Every day there is something exciting. There's something new. There are also days where there's a lot of anxiety. There's a lot of exhaustion and trepidation, and the priorities are big. So if we go to the next slide, some of the things that I found to be incredibly helpful during this particular time is about focusing on yourself and making sure that you take the opportunity to take care of yourself. Staying fit and exercising. I know it's so easy to say to go to the gym and to do that, but actually it doesn't have to be going to the gym. It doesn't have to be going for a 5K run. It could be literally walking for lunch, and walking with some of your colleagues to lunch, and sharing and reflecting on the stories of the day. And even in that small little bit of physical activity allows you to de-stress and to really bring back balance into your life. Make personal time for recharge. As I tell many of my colleagues here at GSK, the work will never end. So make personal time to recharge. The work will always be there, but we also have the choice to make sure that we prioritize a little bit of time so that way we can focus on the things that matter for us. And it doesn't have to always be about work. And it doesn't always have to be about the things and the deadlines and the things that will have to be done. Those will always be there. But I think it's important that we take that personal time to recharge. Managing your calendar. I know this is the easiest thing to do, but I've figured out that I need to make sure that I put blocks in my calendar. And I know many of you probably do that. It's really around whether it be blocking an hour for lunch, whether it be 15-minute coffee break in the afternoon, whatever that ends up being. Make sure you build breaks in for yourself. Make sure that there are times that you really say and you tell the organization, this is family time. This is time for my family. This is time for people I want to be with. This is time for myself, and to really be very vigilant on that because those are important things to help manage those stressful moments. And then the last one is around prioritizing human connection. I think the pandemic really showed us that we as human beings are social creatures. And and now as the pandemic continues to ease and allows us to really engage with colleagues, with friends, with family, and whether you have the occasional BMCC networking event, these human connections are important because these are things that you can't get through a text message, through a social media post, or even through a Zoom call. These are all important things that allows us to feel human again, and for us to stay healthy. And it allows us to really balance not only the medical conditions that we may be working through, but also the mental strain that the pandemic and general life provides for us. So hopefully, as we've gone through today, we've talked about how Malaysia is making healthcare a priority, health a priority in the 12th Malaysia Plan, the preparations that it needs to do from an aging population. We've talked a little bit about how GSK, we're a company, some of the examples that we provide to really how do we make health a priority within our company. And hopefully, these are some inspirational ideas that you can take back to your own organizations, or if you have a better way, I think we're always open to learning on how we can optimize that better and to make sure that we maximize the health benefit. And I think lastly, it's around making sure that we prioritize our own health, by building right healthy habits, by making sure that we focus on ourselves. And our health is the most important thing that we have. And you only have one life to live. So making health a priority for yourself is critical. So with that, I am done talking. I believe I'm within my allotted time. So I wanted to just turn that back to Jennifer and the team to pause and reflect.
Okay, hello again. I'm back. Right. Thank you, John, for that insightful sharing. Wow, really inspiring, honestly, and especially when you spoke about activities within your organization, really, how you help your colleagues to take care, and also talking about the well-being. It's really, really, I'm sure our audience found it really valuable. I did personally, and I do agree with, what you have said in terms of taking care of ourselves, what you do, that time, the blocking the time and all is so important. But before I go on to ask you some questions regarding on your personal, your feedback on your personal, I have an interesting question I want to ask you on that regarding the new generation, because you said human connectivity is very important. We'll come back to that. But I would like to go back to on the nation level itself, John. I think you really started the presentation with a very good question. How well do we know the Malaysia health system, right? How well as individuals or as Malaysians do we know this health system? I think as a Malaysian, my knowledge of Malaysian health system is quite limited. Actually, we are known to have a very good health system, but maybe most Malaysians are not tapping on it. So, and you also say, how can we make the system work for us? So could you share with me, how do you think we can go about knowing more about what is out there in the health system, right?
I think it's fundamentally asking questions. I think all of us, at least I hope, go in for routine health checkups, right? And I think many of us within the business community, we do gembas, right? And we go out and see how our businesses are performing. If I'm using it from a commercial perspective, for example, every Thursday, many of the colleagues from GSK know this. Every Thursday, I go out into the field to meet with our colleagues that are working all over the place, whether it be Penang, Kuantan, Johor, Ipoh, wherever. We go and we go see, and we see how we're doing. How are the people doing? And I think how we understand the healthcare system is very similar to that. Is to go see the health, participate in the healthcare system as a healthy individual, to see how it works when there is no sense of urgency, when there is no need, and to really assess and ask the right questions. Am I healthy? Right? And to really begin to understand the services that are available, that if you were not to be healthy, where would you access those services? And these are the investments. And for most companies, routine health visits are covered under routine insurance. And even if you're utilizing other healthcare facilities, those are typically common. And in a lot of ways, in a lot of clinics, those well visits are free. And the ability to ask questions of those healthcare providers, to ask questions of your insurance providers, to really walk through and ask around those experiences firsthand, really gives you a really good view of what that healthcare system looks like from a I would say a societal view. Not everybody will ask the same healthcare questions as we as a healthcare company would ask, but I think it gives you a really good preview into what that would look like, the difference between private versus public, understanding how clinics refer, understand a little bit around what are specialties and what are general practices, and understanding of those type of things. I think it's important to explore, just like we would explore the mall. Sometimes it's good to explore the healthcare system as well.
I think that's a very good advice, and especially when you talked about asking your insurance agent. A lot of times we only visit what we have in insurance, what insurance we have when we fall sick, and then we find out that it doesn't cover this sickness or that sickness. So that is really a good advice that you're giving, not just for all of us who are already a bit older, but for the younger generation. Start to look at your insurance, because medical healthcare, the affordability will become an issue as we go along. So really, thank you for that answers. Another question is regarding the Malaysia healthcare system itself. It's also a question asked by our audience, one of our audience today. The Malaysian healthcare system, I would say, has survived the 2-year pandemic, successfully survived. You and I can say that, right? But however, there are lots of lessons learned. Every word praises to the healthcare system. Despite many challenges, we have survived successfully, and our vaccination rates are so good, and all so on and so forth. So, with the lessons learned, do you personally view that we are doing enough, or we have started doing enough for improvements, as a nation for Malaysia? Your professional view, from a pharmaceutical company. And what else should we be looking at, right? And to add on to that question, have we done enough? What else should we be looking at? The third question is related to this is it just a role of the healthcare practitioners, right? Should other players in the other stakeholders play a role beyond to get us ready and improve? Yeah.
So I have to be incredibly honest here. I think Malaysia has done incredibly well in the pandemic. I think it survived. But I really do think that during this particular crisis, it just goes to show you that Malaysians, even the government, really stepped up. Because if you look at the statistics, of deaths, the rollout of the vaccine program, etc. If you were to compare that to any other country in the world, Malaysia ranks very up on the top. Now, it does expose some of the areas where can we absorb that amount of volume in one go? And I think this really speaks to the challenge that we'll have in Malaysia over the next 10 to 15 years, is that the volume of an aging population, which is in and of itself something we can see, that the system needs to think about how do we not only think about the scale, the ability to create capacity and the specializations related to that, but also thinking about the portability, because when the pandemic was at its height and the capacity of our government and public hospitals was at a breaking point, there was a move to enlist private hospitals to help offer that, or to give a little bit of refuge or a little bit of break in that capacity surge. But the portability from a government hospital into a private hospital doesn't exist. And so patient histories, patient medications, patient information, all of those different types of things were transferred, but could they have been transferred in a much more portable way that allow the intaking hospital, the private hospital, to really get up to speed, so to speak, to enable and maximize the benefit that system would offer to that particular patient. And I think that's really to think about the scale. Some of those scale things around scalability is around standardization of healthcare. I think we all have the experience where if we go to one hospital or one GP and we go to a different one, we get a different experience across the board. And I completely appreciate that we're looking to differentiate and people are offering different types of things. But I do think that if we can standardize the healthcare administration, it shouldn't matter whether you're going into one hospital A or hospital B, you should have a standardized experience. And as I think about portability, a lot of it is around information and insurance or benefits, right? If you are utilizing government facilities, you don't have the insurance capability to cover you in private hospitals. If you have electronic health records in one private hospital, you can't port them over to another hospital. I think we all have the experience of carrying a binder full of printouts into another hospital if we needed to see a different specialty. So these are the type of things that we need to start to think about and work on to really build scale, but then also to really build out the portability. And then the last thing is we have to continue to build the ability for us to introduce innovation rapidly. Malaysia, on average, introduces new medicines, therapies, procedures much later than other countries, anywhere between 5 to 7 years after they're first visible in other markets. So how do we think about, not only from a regulatory and government perspective, but how do we actually get the healthcare system to be able to adopt that quicker? And the analogy I often use with people is 5G phones and 5G capabilities are going to change the world with a lot of new information technologies that will power cars, will allow us to do many different things, but we need 5G first. And so fundamentally, how do we continue to build the scale and portability within the healthcare system? And I think that's a really great open conversation for many in the chamber to think about, and others.
Yes. So, I mean, I'm coming on to that question. I just want you to share what your thoughts on, the chamber has a representation of diverse membership from the financials and all. So perhaps what's your view on that? Perhaps, the audience out there, how can they contribute? Yeah.
If I think about it, and I've had quite a number of conversations with many financial institutions, right? The number one comment that people have when they go into a hospital or healthcare is how expensive it is. Or can I afford, or can I do this, etc. And I think and to think about how do you answer this without being so crude. You can save money by enabling someone to succumb to their disease and not treat them. That will be the cheapest alternative related to that. And I think fundamentally, we all don't subscribe to that conclusion. We subscribe that all of us offer unique value. I think is one of the key things, that we all bring diverse capabilities, etc., not only to a company, but also to society. How do you afford is really around thinking when you're healthy, how do you invest in your future? Because inevitably all of us will get sick. All of us get old. All of us will, fundamentally accumulate many, many years of bad habits, etc. And from that perspective, how can we start saving for that future? How do we start to make the right investments, not only financially, but also prevention-wise? How do we get there? And to think about what are the incentives from, say, insurance around prevention to mitigate future disease? How do we think about saving for our future when we're in our 20s and 30s? And when we turn 60 and retire and no longer have access to private healthcare, how do we potentially afford healthcare when we're later in life, and we still want to have access to certain specialties that may or may not be available in different institutions? And I think these type of facilities, products and programs are things to think about, not only from the insurance industry, but also from the financial sectors as well. And to think about how do we make that investment in our future through healthcare.
Good comments. Thank you. There's an interesting question here from Rufiza. She's asking, what is your personal view on all, because we talked about affordability for medicine, right? Healthcare. What's your personal view on alternative medicine, such as homeopathy and all, since you represent a pharmaceutical company?
I think it's interesting. We often have this conversation all the time, and I'll share this perspective. Is that if you get better, and I think that's the outcome you want to go after. And I'll give you a really great example. Obviously, this is not speaking to any GSK product or anything like that. But if you look at, some people use acupuncture to relieve pain. And it's been a technique to manage different types of diseases, but in particularly pain management. There's actually a wealth of science related to that, and I don't consider that to be alternative medicines, and those type of things. Massage helps for a lot of different ailments. People with chronic lower back problems will get massage. Will get cervical adjustments in their neck, or they'll be able to. Would you consider these alternative medicines? I think these are the type of things where they're important, and they're physical changes that allows you to feel better, and there's a wealth of science related to that. I think there's also a wealth of science related to how diet and exercise play into your mood, and how that potentially manages disease as well. Can I pinpoint with a statistical ratio and put that into a regulatory filing? No, but I do think that there are fundamental areas where just being good to your body and doing the right things, eating well, staying fit, I think all of these different types of things helps us feel better. And if that's the end goal of feeling better and to be who you deserve to be, then I think all of those type of things are important. All of those things are important. And I think it's part of a complete package. There's always never one solution. And I think how you get better and how you feel better, it all depends on you. But obviously, traditional medicines, Western medicines, physical manipulations, such as cervical adjustments, acupuncture. All of those different types of things are all important. It all depends on you.
Thank you. Thank you. So now moving on to a question from a company perspective. I have a question here from Mizan. In a new normal of employment, distant workforce, emphasis on mental health care, how would you say best for companies, many employers, yourself, maneuver such delicate situations, especially with increasing number of mental health care issues?
I think fundamentally, the pandemic is still here, so I think we have to be incredibly conscious of making sure that we stay safe, ensure that people are kept away from potentially being afflicted by COVID. Obviously, that has other downsides as well. But I do think that we need to just prioritize the conversation. We need to prioritize the physical contact. We need to prioritize the ability to engage human with human. Does that mean that everybody needs to be in the office? No. Does it mean that we need to have big events all the time? No. I think one of the key things that I do, and as I mentioned earlier, is that every week or almost every week, I go and make sure that I'm talking to people face to face. It doesn't have to be big groups. Just small groups to enable us to just have the conversation and just to kind of talk through it. And I think fundamentally it's around just keep talking. Just keep talking. And it doesn't have to be scheduled. It doesn't have to be, so routinized. It just has to be ad hoc. And I think that human element, as trivial as that may seem, a simple coffee, socially distant at a coffee shop, or just sitting in the car as you're driving to a place and just having the conversation does a world of difference to really bring and manage the mental health. I think the other thing is, we have colleagues here who are trying to balance the many different challenges between work and life. And I think as employers, we have a fundamental obligation and responsibility. Yes, we need to push the business. Absolutely. We as a company that provides healthcare to millions of people in Malaysia, we absolutely need to do right to them. But we also need to make sure that we do right to our employees who are out there every single day, working day in and day out to really achieve that, to make sure that we're giving them space and to make sure that we continue to have the conversation, to understand, and to really give them the opportunity to lead the life that they need to lead in order to make it work for them. This is why we do performance with choice. This is why we allow much more flexibility. As long as your work is done, and as long as, from our perspective, healthcare professionals and patients are taken care of, it doesn't matter when or how you do it. And if you need to take care of your family as well, then we should prioritize it. And I think if you do that well, if you do that really well, you can manage the mental health areas. And will it be 100%? No. But I think those are the type of things that we need to really think about. And the last thing I would just say is, if someone says that they are having a bad day and they feel like they're having a mental health challenge, believe them. I think that is the critical thing as a colleague. If someone is having a bad day, believe them. And I think that is the biggest thing that we need to work on, is that when people are bringing up these issues, believe them. They are having a bad day. Let's be supportive. Let's help them. But then also let's make sure that we listen and be there for them as well. I think those are very fundamental human things that we can do.
Thank you, John. We are coming to the 4:30 mark, and now we are getting more questions from the audience. So maybe we'll take one or two. John, I'm not sure you're able to see, but we'll take from David Ng. I think I had a similar question here actually. in terms of, I noted that the government puts preventive measures for CDs, right? Communal diseases, but I didn't see priority for prevention of NCDs. And David has a similar question. Prevention is key. How do you ensure your employees will adopt a healthy lifestyle to prevent NCDs? I think NCDs, you can prevent it. So how do you, instead of tackling it when it comes, but how do you do prevention to that? Malaysia has a big issue in NCDs. As you mentioned,
I think
74% of people total deaths.
I think this is a tricky question, right? And I use my own, I'll use my own story all the time. My mother is diabetic, has hypertension, has all kinds of other type of stuff. And when we go eat, we don't eat very healthy. And her saying, and I'm sure many of you who have parents, it's like, I only do this once in a while. But that once in a while just happens to be every week. and so I think to your point, prevention is key. And I think I think there's a couple of areas. I don't think you can make anyone do anything. I think you need to lead the horse to water. Whether they drink from the stream is their choice. But I think you can obviously build schemes that are much more incentivizing to help them. For example, smoking cessation, right? If you are in smoking cessation, I've seen programs where you get a financial benefit for that smoking cessation, right? Particularly from an insurance company, because you are lower, less likely chance of developing lung cancer, emphysema, COPD, other types of things, where you potentially could get a benefit or a reduction in a premium that you may pay, or more benefits related to that. Those are positive outcomes. You can also show that by participating in a gym and scanning your card and going to the gym, you may also potentially get some incremental benefits as well. You can also make it more fun, quite honestly. A lot of companies promote 5K runs together, a lot of team building activities where you're out to really drive healthy lifestyle. So these will help with eating well, exercising, and those type of things. I think in addition to this, it's around making sure that if you have healthy options within your canteens, and to make sure that those healthy options are available. You're not looking and to subsidize some of those healthier options, because you could obviously pay 5 ringgit for something incredibly unhealthy, fried, all of that, but it's quick. But the healthier salad options may be 6, 7, 8 times the cost. You can also think about from that perspective as an employer, how do you make that available and make it effective for them as well? Again, these are some of the things that you could think about depending in your own situation, and to kind of lead the horse to water, and hopefully it becomes enticing enough that they'll take a drink.
Thank you, John. I think it's very valuable. I'm also going to take those advice. Maybe a health, a good health week or something like that. Everyone eats salad.
But I would also say the other thing, when you make health a priority, take small steps. If, for example, if you're going to lose weight, don't say I'm going to lose 10 kilos. I'm going to lose half a kilo in a week, or I'm going to smoke 1 less cigarette a week, or I'm going to eat 1 less. Start with small goals in mind and to really work at that, because if you try to jump too far, you won't be successful. It's taking those small steps, and I think by the time we're ready to hang up our boots when our careers are coming to an end, we would have taken millions of steps if we take small steps starting early in our life.
Okay, we have come to nearly the end of our webinar. Unfortunately, we can't take all the questions on up. John, I would like to ask, if you have any closing comments to say, as you have given us a lot of takeaways. I put down some points too, but may I ask you if you have some final closing comments as takeaways for our audience this afternoon?
I would say, well, first off, thank you very much, Jennifer and the BMCC, for for giving me an hour to really talk through some of these issues. Again, very, very near and dear to my heart. I think a couple of things to really think about is there is no one solution. And I think just like, as a company that produces life-saving and life-changing medicines, there is no one solution. It takes a complete spectrum of initiatives across the entire healthcare system that enables change for the better. So whether you're working in oil and gas or the financial industry or education or consulting or property management, all of them, the health and well-being of people exists across the board in all of those industries. And if we all make small incremental changes, or I wouldn't say changes, I would say investments in healthcare or in health, I think we have a really great opportunity to really change. Again, not one policy is going to make us all feel better. Not one jab is going to make us all feel better. Not one pill is going to make us all feel better. It takes a concerted effort of an industry, a society, and the interworking of everyone to really make health a priority for all of us.
Thank you, John, for that remarks. But before we close the webinar, I've been asked by my team to do some promotions for upcoming events. So John, please stay with us for a while as I speak. On the 12th of April, we'll be hosting our annual initiative on BMCC Energy Outlook, which is an initiative by our BMCC Energy Committee. This year, it will be still on a webinar format. We have a good lineup of speakers. The program will discuss on the topic of energy transition, which will include initiatives and barriers of achieving a net zero carbon economy. The forum will bring together, as you can see on the screen, a good list of industry players and government officials to discuss and discourse on the matter. I'll also like to take this opportunity to promote our flagship event, the third edition of the BMCC Excellence Award. As John said, networking is very important. So do, come for the awards gala night on the 26th of May at Sunway Resort. You need some human touch. So that will be very good for networking and getting to know other stakeholders and other members. However, we also like to highlight that nominations for the awards, the 7 awards, are still open. So we encourage you to participate, your organization to participate. So with that, thank you everyone for joining. Thank you to John again for your remarkable presentation and advice. I do have some small takeaways that I want to share. Like, for example, get to know your healthcare, healthcare sector, what there's to offer, ask the right questions, and then think about how do we invest in our own healthcare future. Stay healthy. We could do small steps, right? And to make a difference, all of us as organizations, as individuals, can take small incremental investments, to make a difference in our healthcare. So I hope I've rounded up that well in terms of some takeaways. I'm sure all of you will have your own takeaways for this fantastic session with John Pan, Dr. John Pan. John, thank you so much. And thank you to your team, and thank you to my team for putting this session together. And thank you everyone for joining us, and see you again soon.